Welcome to Rumor versus Truth, your trusted source for facts, where we dissect the evidence behind risky rumors and reveal clinical truths. Today, we'll look at popular hangover remedies to see if there's any proof behind the claims.
So this is our second episode of Rumor versus Truth by TRC Healthcare, where we're going to dive into the evidence behind some of those clinical conundrums you face to see if they're actually based on evidence or, frankly, just hearsay.
You've probably heard of Pharmacist letter and Prescriber Insight products. And now we're adding this podcast series to help pharmacists, technicians, and prescribers, and even patients navigate some of the claims they might see about medication therapy. As pharmacists, we are trained to help clear up some of the rumors and identify the truths.
I like that, Don. And I'm Steve, the pharmacist. I've been in hospital practice since 2015, mostly in pediatrics and obstetrics, and I've been an editor here at TRC since 2024.
All right. And I am Don, the pharmacist. I've been an editor here at TRC since 2015, and I've been in outpatient and inpatient pharmacy practice since, I'm going to date myself, 2002, Steve, when you were probably just 2 years old. So
I will not confirm or deny that. Okay. And in this episode, we're going to be making a well-deserved toast to the rumors and truths behind hangover remedies, especially after wrapping up the Super Bowl party season, Don.
Yes. And while we all should drink responsibly, it's also important healthcare providers think responsibly about how to prevent and treat this issue.
And with that, Don, our first spirited claim is hangovers can be prevented by drinking a lot of water. Now, I try to look into this to see if there's any data behind this, and there was one small systematic review that only had 3 studies, and 2 of them were just surveys of college students, so not the best data. And from that, they didn't gather that it makes a huge difference drinking water before, during, or after drinking alcohol. It doesn't really have an effect on hangover severity. And actually, when looking into kind of expert opinions on this, it seems like the dehydration people have with hangover is different from the hangover itself. They might just be separate co-occurring issues. So whether consuming fluids before, during, or after drinking can curb hangovers, the verdict is a rumor. I would say, frankly, we got to need more data for this. So folks, get your research hats on, because yes, again, proper hydration might help with things like a dry mouth from a hangover, but it's not going to help that hangover itself.
Did you say research pants? Did I hear that correctly?
Yeah, why not?
Okay.
Or research hat.
Yeah, I'm going to steal that.
Yeah.
Okay. And let's put on some more research pants here and move on to our next one. And we've gotten some curious questions about whether sayings like beer before liquor, never sicker are true in preventing hangover symptoms. And that means just drinking beer before switching to harder alcohols like whiskey and vodka can prevent hangovers. Now, to note this, symptoms are result of quantity of alcohol and regardless of type. So small studies have shown that neither the type nor the order of consumed alcoholic beverages significantly affected hangover intensity. And interestingly enough, the analyses did show the perceived drunkenness and vomiting to be the strongest indicators for the hangover intensity. Okay, so for the claim of having beer before switching to harder drinks can prevent hangovers, the verdict is just a rumor at this time.
Yeah, that sounds about right, Don. And then another common question I get for folks who have hangovers is, should they be taking acetaminophen for that headache, right? We know that acetaminophen may have liver risks, and we know alcohol has liver risks. So what should they do? In general, what we're able to find is that acetaminophen can be used at normal OTC dosing up to that 3 grams per day for hangovers if it's just occasional drinking, once in a blue moon kind of a deal. But we do need to be more prudent in terms of limiting for chronic heavy drinkers, right? Because their liver might have more background issues going on. So if someone's taking more than 3 or more drinks per day, we should be using acetaminophen sparingly at the lowest dose possible. And some experts even say we shouldn't be going over that 2 grams per day dose. And if you actually look at some of the labeling for OTC meds for hangover that include acetaminophen, they also say you shouldn't be taking it more than 2 days, which is another good thing we could probably tell our patients if they're needing this for a hangover. So for those out there who claim that acetaminophen should be avoided after drinking, Our verdict is true, but with conditions, right? This depends on the dose and the patient's alcohol use pattern. So a lot to take into account there.
Great. That's some good stuff there, Steve. Moving on, I was at the grocery store the other day and I saw these hangover cure products on the counter, and even at the gas station I saw some as well. And it kind of brings up the question, are there any natural products with good evidence for hangover treatment or prevention? And, from the looks of it, many have been studied, but none of those are really robust. One study did look at 82 hangover products on Amazon, and about 60% had one or more vitamin doses above the recommended daily limits. If you look at the fat-soluble vitamins like A, D, and K, that can be an issue. And also, none of them had safety or efficacy data in humans. And about 65% of them made these explicit claims that they treat or prevent hangover. And that kind of rustled the FDA a little bit. And they sent the warning letters out to these companies for advertising unsupported claims on supplements that actually prevent or treat hangovers. So the claim that some natural products can be used for hangover treatment and prevention, the verdict is just a rumor. Many have been studied, but none of them are really robust.
Yep, that makes sense, Don. And that's good to know about the FDA's stance on that. And okay, last call here. It's a high-tech hangover remedy that going to an IV hydration clinic can actually help with hangover symptoms. And Don, I think you were actually recently in Vegas. Did you see these clinics around? I heard they even have like bus versions of these now that you can kind of hitch a ride on.
Yeah, I did actually saw quite a few of them. And, I believe actually you can use some of your casino reward points there to fund them.
Yeah, and the next rumor versus truth we should look at, folks, is how much did Don actually win in Vegas? But that'll be the next episode there. but with that, I think it's important to think about those hydration points we already talked about, that drinking fluids probably doesn't help, so getting it IV probably doesn't help either. And looking at some studies with this, there were two I found that looked at patients who were acutely drunk in the emergency department and whether giving normal saline or lactated ringer boluses did anything versus placebo. And really, they found that it didn't change the amount of time it took for those folks to wake up from their state, their symptom scores, or anything like that. So just from that alone, it seems like giving IV fluids is pretty dubious here. But I think what's also important to think about is the safety aspects. A lot of these IV hydration clinics and medical spas may not be using the same regulations we use in the hospital to make sure IVs are safe. I've got to gown up from head to toe and make sure everything's clean when I'm making an IV. And these spas may not be doing that. And in fact, the FDA, I remember, sent out a publication in 2021 about this, stating those risks. They even mentioned a case where a 50-year-old woman got a Pseudomonas bloodstream infection and got septic shock from an IV vitamin cocktail they got at one of these clinics. So based on that, when it comes to whether hydration clinics are a hangover cure, the verdict is rumor. IV hydration really probably should only be useful in patients who are severely dehydrated. And really, we should be treating that in a hospital, not a medical spa. And also, I'm kind of thinking about the IV fluid shortages we're seeing from Hurricane Helene. We need to be better stewards of IV fluids, and we've got to reserve them for acute and critical needs, which frankly, that's not a hangover.
Yeah, thank you for that, Stephen. Great point about the shortages. It sounds like most of these are rumors or need more data, except for the need to limit acetaminophen if patients are drinking heavily or chronically. Otherwise, you could say most of them tanked.
Good one, Don. And one sobering truth through all this is that pharmacists should really be ready to ask about patients' drinking patterns during counseling if it's appropriate. Because I think we can help patients identify if maybe their drinking patterns are a health issue, and we can also refer them to resources if they want help. And obviously, we ought to remember that moderation, or frankly, just completely avoiding alcohol, is the most effective strategy for preventing those pesky hangovers, bar none. And we also know that limiting alcohol has other benefits too, like decreasing cancer risks. So that's good.
About being abstinent, Steve, you are a buzzkill. But seriously,
sorry, Don.
Yeah, but seriously, there's some good points that we all can cheers to. And that's a wrap on this episode of Rumor versus Truth.
And if you liked what you heard, be sure to follow, rate, and review this show wherever you get your podcasts. And of course, please check us out at trchealthcare.com.
And take a look at our show notes or description. We're linked directly to some of our great resources, like the article on Hangover Remedies in the February 2025 issue of Pharmacist Letter, Technician's Letter, and Prescriber Insights, as well as our handy chart reviewing drug interactions with alcohol.
And if you aren't already a subscriber, don't miss out on these resources. Sign up today to stay ahead with trusted insights and tools. We're an industry-leading, non-biased source of information and continuing education.
And if you're a student, good news. Students can access a free version of Pharmacist Letter. Let me repeat that, student and free. You get a free version of Pharmacist Letter for your student. We're linked to that directly in the show notes as well. Check it out.
And we also need your help compiling more rumor versus truths to analyze. So send us your ideas at trchealthcare.com/contact us, or use the contact us link at the bottom of your TRC Healthcare homepage.
You know, we know you've got some great ideas for us to demystify. Join us next time where we'll tackle claims about tetracycline.
Yep, and thanks for joining us on Rumor versus Truth, your trusted source for facts. We will dissect the evidence behind those risky rumors to reveal clinical truths. See you next time.
See ya.